Thank you and welcome to the show this morning. The topic this morning is the Tobacco Use Project, and we're fortunate to have with us this morning two persons to talk about the impact that cigarette smoking and tobacco has in the community. And we're fortunate to have with us Ms. WMcGowan, who is the director of the Tobacco Project at Tennessee State University. And with Ms. McGowan is Ms. Sandra Hamilton, Nurse Sandra Hamilton. And of course, Nurse Hamilton is a nurse at Meharry Medical College. And let me welcome both of you to the show this morning. Ms. McGowan, before we get started this morning, let's have you and Nurse Hamilton to give us some information relative to your careers up until this point, and then we'll talk about the Tobacco Use Project and the impact that the smoking of tobacco has upon the health and upon minorities. Let's start with you, Ms. McGowan.
Well, currently I'm directing the Tobacco Use Project in the Institute of Government at Tennessee State University, and I'm also directing another program which is called the Bridge Program. But both of these programs are designed to provide services to the community. And with regard to the Tobacco Use Project, it is a project that's approximately, that's been in existence for approximately 1 year. And we're very excited about the program because it has allowed us to do a lot of very interesting things in the community.
Very good. Nurse Thompson, let's find out some information about you and how you became involved in this project.
Okay. I'm a registered nurse at Meharry Medical College. I've been with Meharry now for about 10, 11 years. My background is in oncology nursing, and at the present I'm an oncology nurse coordinator with the Cancer Control Research Unit at Meharry. Meharry is a part of a National Cancer Institute supported consortium, cancer consortium, that brings together the three historically black medical schools. That's Drew School of Medicine in Los Angeles, California, Meharry Medical College here in Nashville, and Morehouse School of Medicine in Atlanta, Georgia. These three schools are in the Drew Meharry Morehouse Consortium Cancer Center, and it is a project that's, as I say, supported by the NCI, and for the research, control, and prevention, as well as some treatment aspects of cancer in minorities.
Very good. And so both of you are working very intimately with this Tobacco Use Project. Now, of course, Ms. McGowan, we've seen quite a bit of information around Nashville in reference to this project, but why don't you give us some information relative to how that project got started, and of course later on Nurse Hamilton will give us some information about the effects or the health effects of tobacco. But how did you get started with such a program?
Well, the Tobacco Use Project is actually funded through the National Heart, Lung, and Blood Institute, and as I said earlier, we got started about a year ago, and basically our mission was to find out if, in fact, there was a need for such a project within the black community here in Nashville. And after going out and doing community needs assessment, we were able to determine that there's definitely a need. Once we determined that there was a need in the community, we went about bringing together leaders in the community to help us put together a meaningful program. And the leaders that we brought together basically directed our action in terms of what it was that we needed to do. And we formed several different task forces, and each task force set out specific objectives that they wanted to achieve, and we went about working on the project that way. One of the persons who has been very instrumental in the project is Rick Stevens, who is a graduate student at Meharry Medical College, and he has basically orchestrated the majority of the work with the project.
Very good. And so this is a project that's designed primarily to deal with the problem of smoking in the community. Nurse Hamilton, let's look at some of the health effects of smoking. I think that we can talk about how detrimental smoking is, but from a medical point of view, what are some of the health effects that you've observed, and certainly as a person who's intimately involved with the whole cancer process, what are some of the health impacts or effects of smoking?
Well, obviously, cancer, obviously it's known now that tobacco use, not just cigarettes, but smokeless tobacco and snuff, are very high risk, create high risk factors for patients, and create or causes of lung cancer as well as oral cancers, cancers of the tongue, the larynx, those cancers that are involved with the mouth and that area. And it's also pretty widespread known that cancer of the lung is caused by tobacco use and smoking. one of the things that people seldom think about is not only does the smoker have a prevalence toward cancer because of tobacco use, but those persons around them, the passive smoker, the person who's exposed to the smoke just by virtue of being in the room with the person. I keep referring to people as patient. I'm so patient-oriented. As being in the room with the person, riding in the car with the person, being in a nightclub or around the person that smoked, they're also exposed to those cancer-causing materials that are in tobacco and cigarette smoking. Additionally, smoking has a high impact on cardiovascular diseases as well as on diseases of low birth weight children. It also is known that cancer is the cause of some other cancers other than lung cancer. Cancer is a known factor in breast cancer. I mean, tobacco use is a known factor in breast cancer, in some GI cancers, as well as the lung cancers. We know that from research that women who smoke during their pregnancy have low birth weight babies, and this leads the babies into health problems that they can have not only right after delivery but during their lifetime. We know that there's a high incidence of asthma and respiratory diseases and respiratory infections among children who live in households with smokers or that are exposed to smoke. We also know that some women have earlier menopause because of tobacco use and smoking. And there again, we have cardiovascular disease. Smoking and the ingredients in tobacco can lead to increased heart rates and cardiovascular diseases and be contributory to heart attacks.
And so not only is the smoker affected, but every person around that smoker in the environment, as you've indicated, nurse, is also affected. Earlier, Ms. McGowan, you said that you made an assessment of the community needs. Now, what did that assessment include when you went out in the community? Exactly what were you